Hi, everyone. I'm Lana. Thank you so much for joining me. President Biden celebrated the progress made against the pandemic in Virginia Friday. Vaccinations continue to climb as cases fall. But Mr. Biden says we're not done yet. More than 40% of the population is now fully vaccinated, and the focus is on reaching those who aren't. Meanwhile, New Jersey joined a growing list of states to lift its mask mandate on Friday. It comes just in time for Memorial Day weekend. The CDC says vaccinated Americans can safely enjoy the holiday restriction-free. But those who aren't are advised to keep wearing masks and taking precautions. Also on Friday, the CDC put out its much-anticipated summer camp guidance. Manuel Bojorquez shows us what the agency is now recommending.
Tonight, the new guidance on summer camps is causing confusion. The CDC says camps are safe to reopen at full capacity without social distancing or masks if everyone is fully vaccinated. But children under 12 aren't eligible yet. The CDC is also saying everyone, vaccinated and unvaccinated, may consider masking indoors in areas where transmission is high, a conflict with the masking guidance released 2 weeks ago. Today, the president pushed for more people to get the shot.
We have to reach those who are not vaccinated and make it as easy as possible for them to get protected.
That protection wasn't there last summer when a surge of infections and deaths were believed to be linked to rowdy Memorial Day gatherings and some states' early reopenings. Miami Beach was largely closed last Memorial Day. This year, it's open. But Mayor Dan Gelber is concerned about putting too much faith in the honor system for unvaccinated visitors.
The state of Florida and the governor have not allowed us to check to see whether people are vaccinated. And that, of course, means that we just hope people are, and we hope that they're not spreading the virus elsewhere.
Dr. Eileen Marty says these are all encouraging signs of life returning to normal. But the virus won't stop looking for ways to spread. And Florida continues to lead the nation for more contagious COVID-19 variant cases.
I am very concerned about people who are not vaccinated who think that because the rates are down, they're off the hook. They don't need to get vaccinated and they're not going to get sick. They're wrong. They could very well get sick. They could very well end up in the hospital. They could die.
As more people hit the beaches, crowds are also expected at theme parks. And starting tomorrow, Universal Studios in Orlando says fully vaccinated guests will not have to wear a mask indoors or in lines, but the park will not require proof of vaccination. Lana?
Manny, thank you. For more, let's bring in Dr. Brittany James. She's a family medicine physician, the co-founder of the Institute for Antiracism in Medicine, and an assistant professor of clinical family medicine at the University of Illinois. Dr. James, great to see you. And, you know, we're looking at this Memorial Day weekend and seeing brighter days ahead. To look at how far we've come, one doctor quoted in the New York Times actually said, at this time last year, we were at the end of the beginning of the pandemic. And this year, we're at the beginning of the end. So how confident are you that people can safely celebrate this year?
You know, I think if you're vaccinated, it's, have fun. We know the science is there, it's safe. And really, I think the takeaway is just we want to get everyone to that place where they can safely celebrate. So if you have the eligibility, if you're over 12, get vaccinated.
Well, the CDC released guidance for summer camps on Friday. You heard Manny talking about some of the confusion. The agency says that camps can reopen without capacity limits and mask mandates if all campers and staffers are vaccinated. But for people with younger children, this potentially presents some problems. So what else is the agency recommending? And really, what does it mean for younger kids who cannot be vaccinated at this point?
I think people have a good feeling. We're in a place where we can't know things for sure. And there is some judgment to this. Of course, if you're vaccinated, but if you're in close proximity, we have to look at what the ventilation is in the space, how close people are together. It's still parents making the best call and what's good for their children. And of course, we know that for our kids who are under 12, it's not even an option. So, I think that all the advice has to be taken with, looking at your own unique situation, your vaccination situation, what kind of camp you're going to, what age groups are there, and what kind of activities are going to be there. And, have to make the best decision for that situation.
I want to ask you about this increase in reports of heart inflammation in people who have received an mRNA coronavirus vaccine, which, to be clear, are all 3 of the vaccines that are currently available in the United States. The CDC is now urging healthcare providers to ask patients, particularly adolescents, if they have symptoms of myocarditis or pericarditis. And I may be pronouncing that wrong, so my apologies. You can correct me since you're the doctor. But explain what the symptoms are, how big of a concern is this, and really what it is for those of us who are unfamiliar with this concern.
Yes, and as soon as someone hears the heart, of course you're going to be nervous. So what we know so far, I think the important thing is, so myocarditis, pericarditis, we're talking about inflammation around the heart. The important thing to know is that this isn't a new phenomenon to the coronavirus or COVID vaccine. In fact, when we look at it, these are a handful of cases where there is no clear link between COVID-19 vaccine and myocarditis. But again, we're watching so closely that we just want to make sure that that connection isn't there. So far, what we're seeing, we don't see a higher number in people who got vaccinated compared to people who didn't. So I think that's the big thing. We're not jumping to any conclusions. We're just being extra careful to make sure that there isn't that link. Right now, the advice still stands. We still think it's the safest for anyone over the age of 12 to get vaccinated. And that's really the best thing that we can recommend based on the science. But of course, we're going to stay on top of it, monitor. But right now, that evidence that there is a link just isn't there. But we're going to watch for it.
Okay, that's helpful to understand, because you see those headlines and immediately, the mind starts racing. So we appreciate those fact checks. Finally, Japan extended its state of emergency on Friday. It's expected to end about 1 month before the Tokyo Olympics begin. Prime Minister Suga says that infections are slowing, but the situation is, quote, still unpredictable. So what are your thoughts on the games being hosted there this summer?
I think that this is just another story that we've really seen played out over and over throughout this pandemic, this sort of tension between the economic boon and sort of people wanting to be back to normal life and the reality, that we have to be safe and we have that responsibility to each other to make things as safe as possible. So I'm certainly watching closely. You're asking a physician, so my bias is always going to be on the health and safety of folks. But, I think that it sounds like they're taking everything into account and weighing all the options. Not an easy thing, but of course, protections have to be in place. And if the numbers are not improving like, they're hoping, I do hope that, they make the right decisions to keep everyone safe.
All right, Dr. Brittany James, thank you for being here, and thank you for all that you do.
Thank you.